thank you, Betsy, for joining us. I just wanted to, first of all, re-congratulate you for Wellbrain's BTA Challenge win. I believe it was just about a year ago, right?
Yeah, it was.
It was the spring of 22 that Wellbrain submitted and was one of the winners of the BTA Challenge. So real quickly, tell us how that has been and what Wellbrain has gotten out of it. How have you benefited and how has that impacted Wellbrain and what you guys are doing?
Yeah, so it was about a year ago, and we were really excited to be able to present. And I think we got some excellent feedback. We were going through some transitions team-wise, and it really helped the team get re-energized on our mission related to chronic pain. I think that it made us think out of the box, and it gave us obviously exposure that we hadn't had. It was just a great experience, and it was my introduction to HITLAB, so that was exciting as well.
Excellent, excellent. So let's tell the audience a little bit about what Wellbrain is and why it's important that we're talking about Wellbrain and what Wellbrain does, specifically as it relates to the mental health issues.
Yeah, so we're a digital health startup that focuses on chronic pain, and a lot of our competitors are focused on MSK, right? And so we are looking at all disease states, including women's health, right? Things like fibromyalgia, cancer care. We are not focused on just MSK. So we also know that 85% of people that suffer from chronic pain also have mental health challenges. So it's a big part of what we do. I like to use the analogy of keeping people in the guardrails, right? So we want people that suffer from chronic pain to have the tools, and their providers to have the tools to keep them within the guardrails. And I loved what Meg was talking about, because I think eventually utilizing AI will definitely play into that, right? Because the more data we can capture, the more we can predict. And again, we can try to keep people from moving out of the guardrails. So how we do it is we have over 20 clinically proven panels, patient-reported outcomes that result in an overall brain health score, right? And those include things like anxiety, it includes level of pain, it includes medication management. And each one of those play into this brain health score. And that is something that a provider can prescribe automatically. And you can look longitudinally at it, so a provider and a patient can understand where they fit in their chronic pain journey. And I think the ultimate goal is to work to retrain the brain, right? To be able to manage pain differently, and really focus on medication management as part of that. To again have functioning. People that suffer from chronic pain to be able to function in whatever that looks like for them. So from that brain health score, we have a set of mindful meditations that are very tailored to whether it's sleep issues, pain issues, anxiety issues, that were all developed specifically for Wellbrain by a monk. So those are available. And then from that, we also have movement. So we have virtual physical therapy. So a patient can say, I'm having arm pain, or I'm having whole body pain when it comes to something like fibromyalgia. And from that exercises are provided via email or text. And so, it's all virtual. And then we also have a behavioral health telepsych network to be able to focus on things like anxiety that can be a big factor, obviously, for somebody that has chronic pain. So we really try to look at whole person health, not to overuse that word, but I think it's really important. And our goal is to keep people functioning.
Excellent. Yes, I know personally how important addressing that mental health component of chronic pain is. Separate from my work at HITLAB, I also run a nonprofit organization associated with the opioid epidemic. And for chronic pain patients, it's unfortunate that too often most chronic pain patients are relying almost 100% on pharmaceutical options in order to address their chronic pain. And we know that there are so many more facets and aspects to chronic pain, and pharmaceutical options aren't necessarily addressing 100% of that. And really, pain is a phenomenon in the brain. It is rare, especially chronic pain. It is not, or it is rarely a phenomenon of an actual, injury somewhere in the body. It is the perceived. So the mental health component is so critical. And it was wonderful getting to know what Wellbrain is and working with you guys in order to understand how Wellbrain is addressing that mental health component. So kudos to you.
Yeah, no, we are a mission-driven company, and there's no doubt about that. And it really is, it initiated with the founders, who are all chronic pain physicians, and their struggle with the opioid crisis, and the fact that, patients just wanted the meds and they knew there was a better way. And to your point, we really believe in the concept of retraining the brain to manage the pain. I kind of feel like Eliza Doolittle in that, but I think you get the point. Retraining the brain is really important, and it's a big part of what we try to do with the tool sets that we provide both physicians and patients.
Excellent. Well, real quickly, because we only have a few more minutes, as part of the BTA challenge, you guys worked with HITLAB in order to fulfill a small a research study. And through that study, we looked at your platform and we did a heuristic analysis. Can you tell us just a little bit about how that really benefited and what you took away from that research done with HITLAB?
Absolutely. So number one, first of all, thank you. It was a great experience for us. So, and a huge bonus. So one thing is that we walked away with a lot of positive feedback related to usability from our platform. And that was just great information and validation. And then secondarily, there were some excellent recommendations on engagement. And I think everybody knows in this digital space that engagement is critical, right? I don't care what we're doing, and especially with patients, right? And so what it brought to light is things that we needed to do to focus on related to engagement. So we've made some additions, we've added text, we've added surveys. And so it really gave us focus on sort of next steps when it came to the overall product roadmap. And, we're just forever thankful for that. Yeah, again, really enjoyed the process.